I love working here because Stillwater Medical Center cares so much about the patients. They care about their staff members. The entire hospital works as a team to promote the well-being of our patients, and it's just a super place to work.
For 20 plus years as a labor and delivery nurse, and prior to this I worked in the nursery in OU in Oklahoma City, and so I've got a lot of great experience. This position that I have now as the manager of the unit is not something that I really thought I was ever going to do, but it kind of happened because we lost our manager suddenly, and I took the position because a lot of the staff kind of had faith in me that I could do this, so this is what I'm doing now, and I'm learning as I go. But it's a wonderful place to work. My staff is like my second family. We're all very close, and we care very much for each other. So we really don't have a lot of staff turnover. People come here. They usually stay here if they become part of the family. So.
And as far as what I do here on Maternal Child Health Unit, I'm in charge of the pre-admission program, which means when people want to, tour the unit and talk about their birth plan and just admit to our unit before the baby's actually born, we ask a lot of questions to get those out of the way, have consent signed, go over what their views of labor and delivery are and what their plans are, and then do a tour of the unit. And then also, when they're here, I try to see the moms that want me to come in, and I'm the lactation consultant for our unit, which I've done for about the past 10 years and was a certified breastfeeding educator before that. And then afterwards, if they want me to make a home visit, I'm also in charge of the mother-baby home visit program. So it's really a neat kind of a job because I get the before, during, and after, and then I also teach some of the classes, the breastfeeding class and the sibling class. So there's lots of opportunities here. You don't feel like you're just stuck in the same kind of job all the time. There's lots of variety in the position, and that's one of the huge drawing factors for myself.
We have 37 staff members, including myself, and we encourage the staff members, all that want to become labor and delivery nurses, so that we can take care of everyone on the unit. We have mothers, babies, and of course the labor and delivery area. All of our nurses are certified in neonatal resuscitation, and we do that every 2 years. And we also do PSEP. It's a perinatal continuing education program. We do that every 3 years. So it keeps us up in our competencies and make sure that we take safe care of our patients. Those are some of the educational opportunities we offer our staff, along with sending staff to fetal monitoring courses, stable classes, and things of that nature. We have 5 labor and delivery rooms, and we have 9 postpartum rooms. We have 1 triage room that has 2 labor beds in it also. We have a C-section room on the floor, so if you were to have a C-section, we just go to another room on this unit. We don't have to leave the floor. So it's very accessible for that reason, especially if you have an emergency situation. It's very easy to get there, and we can do it very quickly. So
we really are a secure unit. We have the locked doors and only 1 entrance and exit, and only the staff can use the elevators. And the only way people can enter the unit is if they have access to our unit, which are the nurses that work here. And of course, we have the blue badge policy, and only our badges work on the unit. And then we also instruct the patients as well to watch out and make sure that the nurses taking the babies always have, from the room in their cribs, always have the blue badges on. And that's another safety feature. The families know too that the baby is only supposed to travel in and out of the room in the crib. So, that cuts down on the fear that somebody's going to take the baby from them in the middle of the night and that kind of thing. So we also only have family members or people come to visit them have to know their name. They just can't be, their neighbor or something like that. They have to actually know their name. And then the security cameras are viewed in security and at our nurses station. So we watch the people coming and going from the unit.
Well, this is my first real job that I've ever had as a nurse, and I work on MCHU, which is the baby mama floor, and I love working with mamas and babies. All my coworkers are awesome to work with. I love coming to work every day. And we all get along. We have a lot of fun up there, even when it's busy and swamped. We still have a lot of fun. Everybody pitches in and works together. And then just the whole staff of the hospital all together is fun. Anytime you go to the cafeteria, everybody's friendly. Snack bar, people are friendly, people in the hall. So it's just a really good place to work.